Good morning. I am Kevin Price. Delighted to be with you. Going to spend some time talking to you about you and your business. Always look forward to having Kurt Nordquist here on the program. He's a regular contributor on The Price of Business, and he's with NetSync Network. That's netsyncnetwork.com to look him up. And you guys really do some extraordinary work. You do a much better job than I do at articulating what all you do. Talk a little bit about your company, and then introduce us to your guest today, which looks like a great one, by the way.
Thanks, Kevin, and great to be back. So NetSync is a Texas-based end-to-end IT solutions provider. So what we do is we work as consultants to design purpose-built solutions for our customers. Based on their business needs, we'll do the design work. We will perform the implementations, provide ongoing technical support for oil and gas and healthcare customers, bringing the best-of-breed hardware and software companies you hear and read about every day. And we really work hard as a go-to partner to help these customers get the most out of their IT investments over the long haul.
Very good. And your guest today?
Certainly. So let me tell you a little bit something about Texas Health Resources. Now, they're one of the largest faith-based nonprofit health systems in the United States. The health system includes 25 acute care and short-stay hospitals that are owned, operated, joint ventured, or affiliated with Texas Health Resources. It includes Texas Health Presbyterian, Texas Health Arlington Memorial, Texas Health Harris Methodist, Texas Health Physicians Group, and there's outpatient facilities, behavioral health, and home health. Quite a mouthful, basically, Kevin. They're big time.
Yeah, big time, to say the least. Elizabeth Ramson, our guest, welcome to the program. Tell us a little bit more about, kind of give us the elevator speech, if you will, of your organization.
Sure. Well, you heard a little bit of the background, and we are one of the largest faith-based organizations in the U.S., and we're certainly one of the largest providers of healthcare in the Dallas-Fort Worth Metroplex. And really, our organization, our healthcare organization, is committed to improving the health of the people in the communities that we serve, and really along the entire spectrum, along the entire continuum of care, from keeping people healthy on the one end to taking care of them when they need hospital, acute care, and then to taking care of them on the other side in the post-acute setting as well.
Very good. Kurt?
So, Kevin, Dr. Ramson, she is a previous CQO, that's a Chief Quality Officer, and right now the Exec Vice President of Texas Health Resources. Doctor, according to the Centers for Disease Control and Prevention, diabetes affects the health of about 9.8% of the population of Texas. That's about 2.6 million people. Diabetes costing us more than $18 billion a year in medical costs, work time, loss of productivity. Given the prevalence of diabetes, how has Texas Health Resources approached this issue?
Well, as you said, diabetes is certainly a tremendous burden across the country, but particularly in our area, in Texas and in the South generally, there's a very, very high proportion of patients who suffer from diabetes, and an even greater number who have prediabetes who often don't even know that they have this. So when we decided to embark on our diabetes program, we really looked at how this was impacting not just the patients in our hospital, but really our entire community, and that's why we decided to pursue this endeavor.
Yeah, that's interesting. By the way, let me get the website out for both Kurt, which is netsyncnetwork.com, NETSYNC network.com, and Texas Health can be reached at texashealth.org. That's simple enough. Kurt?
Evidence-based care. Dr. Ramson, can you tell us a little bit more about that, and what kind of outcomes have you seen?
Sure. Well, really one of our main goals was to standardize our approach to taking care of diabetic patients, both on the inpatient side and the outpatient side. So in other words, whether a patient is goes to one of our hospitals in Allen or Cleburne or is seen on the outpatient side in Fort Worth, we really want them to have the same level of excellence care. And to do that, we've standardized our approach both in the education of patients. We've educated all of our inpatient nurses, and we have standardized education programs for our physicians as well. So really, we follow protocols across the entire system that are based in the latest and most up-to-date information that's available. And frankly, we're really starting to see some positive results because of this. So when we look at some broad general measures, for example, overall glycemic control, and basically what that means is that we look at all the patients who come into our hospitals and what percentage of them have glucose values that are in range or where we want them to be. And that percentage has steadily increased. Now, obviously, you never get to 100% because the reason often why patients come into the hospital is because their glucoses are out of whack. But we're managing to get that under better and better control. And also, we look at our readmission rates for diabetic patients, and those have steadily gone down for patients with a primary diagnosis of diabetes as well as those who come in with a secondary diagnosis of diabetes.
You talk about making it much more accessible, healthcare much more accessible. Kind of give us an overview of the range of what that entails.
Well, really, when we look at our program, we focus in several different areas. On the inpatient side, certainly we want to identify and manage those patients who are initially diagnosed with diabetes and make sure that they learn about their disease, and then we follow them on the outpatient side, make sure that they're hooked up with a primary care provider, and then they can follow up in continuing education with us on the outpatient side. And really, we're working also with our primary care providers and our physician group and our independent physician partners to really try to reach out into the communities and, again, not just take care of our diabetic patients, but really try to identify those who are at risk for developing diabetes or who already may have prediabetes so that we can hopefully start to bend that trend away from increasing numbers of people with diabetes and really start looking at prevention.
Mm-hmm. Kurt?
So, Dr. Ramson, all of these best practices and protocols that you speak of, safety has got to be top of mind. How has this improved safety, and if so, how?
Yes, well, safety is a big concern for patients with diabetes. Insulin is a drug that generally often ranks, if you look across the country in hospitals, as one of the most common medications prone to errors. Usually it ranks in the top 10. Wow. And our system was no different than anyone else. It was roughly around that. However, once we started this program, the number of errors, the ranking of insulin went down to 12th, and then last year actually down to 36th place. So we think that our education efforts for our staff and for our physicians is really starting to pay off, and tying that with our patients as well. So in addition, we've had no major or catastrophic errors related to insulin, and in fact, there's been an 83% drop overall in insulin errors in our hospitals since we started this program.
Wow, that's impressive. And what kind of things are you going to do to continue that that effort, to expand that?
Well, really, our efforts will not stop in continuing to provide the best evidence-based care for our patients in the hospitals. We continue that work. That will be ongoing. And as I said, we're really trying to work with our physician partners in the community and other community groups as well to really try to raise the level of awareness and really start to focus on prevention so that we'll have fewer and fewer of those diabetic patients who come into the hospital.
Kurt, have to wrap it up on that point. Your final thoughts?
Very good. So, Kevin, technology continues to impress me at the speed in which many of these advances and services that the healthcare industry is bringing to the market for the benefit of all of us. I just love this technology and medicine series of interviews that we've had. And Dr. Ramson, I want to thank you very much for sharing some of your thoughts with us today with what you're doing with your organization.
Well, thank you. I've enjoyed it very much. I appreciate it.
Yeah, I think it's phenomenal. Thanks so much to both of you. Great as usual. And when we come back, we're going to have much more for you. We want to remind you this interview and much more will be found over there at usdailyreview.com. While they're liking on Facebook, follow it on Twitter.
I'll buy you a diamond ring, my friend, if it makes you feel all right.